He's going to be sharing a bit about the experience in Kenya. And great, so I'll hand over to Ben, and then we'll keep that poll open for a while and return to it after Ben's presentation.
All right, so as you can see, in Kenya, the first case of COVID was reported around the March the 13th. Well, reported in the sense that that's when we started testing. So that's when we actually knew when the first cases were. And the graph, as you can see, just shows the trend in terms. So the top blue line is the cases, the number of confirmed cases. So as of yesterday, we had 384 cases in the country, and the government has been testing. So far, we've only tested, I think last time I was checking, to around 17,000 people. So our testing has not necessarily been as robust as the West. So I think on average, we're doing, I think it was close to 200 tests a day or something like that. So in the last month or so, we had only tested around 70,000 people. But as you can see, with the confirmed cases, it's been a gradual trend upwards. But just so that we are clear, so cases means you tested positive, does not actually mean you were sick. So majority of what we're seeing from the test results, even here at where I work is, because we are actually one of the testing centers, is patients are coming in and testing positive, but they are perfectly healthy. And we are sending them out back to self-quarantine at home or be quarantined by the government. The guidelines have changed periodically, but majority of the patients are actually not being, majority of the cases are actually not being admitted in hospital, potentially self-quarantine at home. The second line, you can see the trend one is the active cases. So cases, once total cases would be the 384, active cases would be people who are still in quarantine who have not tested negative. So after 2 weeks of quarantine, they test you, you test negative, then you drop off. So in terms of active cases, we have 241. So the graph, as you can see, is the blue lines, the blue bars around the new cases per day. So as you can see, it's been 7, 10, 7, 10, 15. Again, this has to be interpreted in as per the number of tests being done per day. So it's very biased data because it's very limited to how many tests are happening per day. So not necessarily that has been the trend, but even with the trend, you can see the number of cases, even with the 200 or so tests per day, it's not that many being picked up. It's all pretty much below 20 or so majority of the time. The green line just shows the new recoveries as they're happening, and more people are recovering. Recovering just means you tested positive at one point, now you tested negative. Doesn't necessarily mean you were sick at one point, now you are not sick. Most of the people are just based on purely the tests, and we are doing PCR testing at most of the facilities, and this is what is being used to tally this. The red are the deaths. Okay, so our first patient died on the 26th of March. That's like 13 days into the active cases in Kenya. And subsequently, as of yesterday, total number of deaths, we've been at 14, I think 14 deaths or 15 deaths as of yesterday. So not many patients have died. We've had, at my where I work at Aga Khan, we've had I think we've admitted 3 or 4 of them in ICU, and only one person did pass on. Is one of the patients is here, but the rest of them have been pretty much gotten off ICU and discharged home. So we have a relatively good success rate with our ICU care here at Aga Khan. Globally, again, this is data coming from the Ministry of Health, and this is what we are seeing on the ground. So from the beginning, the government has been we locked down the country quite early, and I think it was around March, from when the first case came through. I think by the end of that week, we had locked down the country. Lockdown meaning the borders were closed off, flights were reduced, and eventually stopped. And subsequently, as of beginning of April, yes, I think 6th of April, we actually did go into a lockdown where certain areas of the country, certain parts of the country couldn't travel in and out of the part of the country. So these were the key hotspots areas. So we have key hotspots, which is Nairobi and Mombasa, Kilifi. These are different counties, and they were locked down, meaning you couldn't come in and out of those counties. Additional government responses that have happened is curfews. So we've had a curfew between 5 a.m. and 7 p.m. So, no, well, it's 7 p.m. to 5 a.m. the following day. Pretty much you are not allowed to be outside unless you're an essential health worker. And the police has been quite keen on enforcing this. And this has been there, I think, now probably from the end of March this year. End of March, yes. And this is still enforced, though with the new trend in terms of cases and numbers not necessarily going that significantly up, the government is starting to relax some of this. I think as of last week, they've opened. So all schools were closed from the beginning. Restaurants were all closed. You could only do takeaway services. Churches quickly and all religious ceremony things eventually followed. But we've recently just reopened the restaurants with some guidelines sitting in the restaurants, but everything else remains shut off. Um, from a government response perspective, the Ministry of Health did come up with guidelines on COVID management quite early, both for adults and pediatrics. And this was then implemented on the ground. Most of we have designated isolation centers. We have two in Nairobi, I think Kenyatta and Mbagathi also in Nairobi, and different counties across the country have set up isolation centers. Majority of these, again, do not have any patients in them. They're just really good to go. Having patients at the moment. But we have a quarantine centers, and these are places where if you tested, so initially, the issue if you are traveling to the country, you got told to stay home for 2 weeks, self quarantine. That did not work very well. So the government went ahead and designated quarantine centers. So anyone flying into the country, coming back into the country, was put in these centers where then they were quarantined for the 2 weeks by the government. And also, if you test positive, then sent into quarantine centers now for the 2 weeks to be monitored and then discharged. So for the last month or so, yes, anyone. So previously, is anyone coming in, but also now for anyone testing positive, you're sent to a quarantine center and you are quarantined there for 2 weeks. And then once you test negative, you're going to be discharged. So that has been in place and still ongoing at the moment in a bid to reduce the number of people who have tested positive circulating in the community. Additionally, a lot of supplies, PPEs, were procured by the Ministry of Health and were supplied. Naturally, this has not been enough. And on the ground, there's been a significant outcry by healthcare workers about lack of PPEs. So even Joe's presentation is good. And a lot of this has gone in place, but many people actually on the ground are having to reuse PPEs. So having to look at the guidelines of how to reuse PPEs because there's just not enough PPEs in a good number of areas. So, and I think this is probably something that is similar across many African countries. So what else has the government done? So messaging, the government has been very proactive in messaging and providing messages about wearing mask, wash your hands. So a lot of wash your hands campaigns have gone through. This was one of the initial ones, campaign again around the stigma and not stigmatizing COVID and guidelines on PPEs and use of that. But also just to discuss, so at the beginning of it all, also the government set up a hotline. And this is for us, actually, if you ask me, one of the benefits that we've had of this whole pandemic is Kenya does not have an emergency hotline number like 911 or 112. 719 is actually the first emergency hotline number that we've had that was set up quickly between the government and a local mobile phone provider. And this hotline has been very active in and actually had doctors manning it at the end of it all to be able to pick up potential cases. And at the end of the hotline, there we have a rapid response team on the ground from the Ministry of Health that then is able to follow up on the cases where if people are suspecting someone or someone is potentially showing signs and symptoms or someone's actually sick, they call the hotline and a rapid response team quickly take uh, someone along for treatment at the designated treatment centers. Um, Interesting enough, naturally, the hotline has had also additional calls from regular emergencies, especially at night with the closure or with the lockdown measures. With no available easy to move transport, many people have been calling 709 to get emergency care. And the number has pretty much looks like to be one of our hotline numbers for a while. And we hope it will stay beyond the pandemic, where we actually have a number to call in case of an emergency. So overall, looking at the numbers, looks like we are probably headed out to making some recommendations in the next couple of weeks or so about potentially some areas. The good thing is, and this is looks like the numbers similarly across the continent, is our death rates are not that many. So thank goodness, because our resources have been quite limited. I think at one point when there was a big discussion about the availability of only, I think we only had close to 200 critical care beds across the country for 50 million population. Some areas actually have actively started equipping and developing new critical care areas, so that's a plus again. But a lot still needs to be done to improve our healthcare system, and this was a good wake up call, I think, from for all for the government and all other stakeholders about improving our emergency and critical care services in the country. So, as in a nutshell, the situation has been fairly stable and manageable within the country. A lot of measures are put in place to reduce the spread of the disease and also tackle the cases and the sick patients that are coming through. But all in all, I think there's still a lot needs to be done, especially in view of the fact that this is a disease that's going to be with us for a while, and we will still need to keep doing a lot of the issues, a lot of the things we've been doing to try and keep things at bay. So I think yes, that was a quick summary of what's happening to Kenya. Maybe I can pick up some questions.
Thank you, Ben, by the way, for that lovely presentation. I also see we have a question about discharge criteria for COVID-19 patients. I know it's a bit different than the PPE, but I don't know if either Ben or Joe wanted to share a bit about what the discharge criteria for COVID-19 patients is.
All right, I can quickly take that one. So right now, what we're using, of course, your clinical symptoms must have resolved. So if you are admitted for hypoxia and all other clinical presentations, then you must have pretty much gone back to normal. But what we're also using is two negative tests done, I think, 12 hours apart. The 12 or yeah, 12 hours apart, then you're being discharged.
Wonderful. Thanks, Ben. There's also another question for Ben. How has the private sector generally been engaged during this pandemic treatment of patients?
Well, this is one disease that did not really discriminate between the haves and the have-nots. Everyone was being affected equally. On our sector, there's a private sector from the perspective of the industry, and they've done a lot of public campaign donations, especially around water and sanitation across the country. A lot of private sector also donated some kind of amount of funding to the government to support its efforts. From the private hospitals, we've been on the forefront here at Aga Khan as one of the big private hospitals, and have I think we're probably the only one of the private hospitals that has had a good number of critical care patients. So we've been working a lot. Being a university hospital, we worked a lot in terms of trying to develop guidelines, share our experiences, even with the government, and share our resources with the government in trying to support the government's efforts. So this is one situation where we are all in it together, and we've been working very closely with the Ministry of Health here. Yes.
Thank you so much. And I just want to be aware of everyone's time. We appreciate it. All of you have given us a full hour of your day. I know everyone is very busy. So there's a few lingering questions that you have posed to us as participants. A few of them I think would be great for us to dive in deeper on in future webinars, specifically some questions about lifting of lockdowns and what that transition will look like. So we will take that back to our office and hopefully get kind of a more thorough answer. So please continue to share your questions if you have them here. You can always also contact us at programs@afem.info. And then I just wanted to mention before we close today, one, a huge thank you to both Joe and Ben for presenting and sharing their wonderful presentations. We will make those available online on our AFM website on the resources page. And with that, we'll also include a lot of the resources that were mentioned today. So the PPE burn calculator. I think I also saw a disinfecting of ventilators link. So we'll make sure those are all available in one area and send them out in an email. The last thing we'd like to ask is we have a survey here. I'm going to drop it in our chat function. If you could take a moment to answer about your experience today and the topics, it would be hugely helpful. So thank you everyone so much. As always, we appreciate you making the time and we will see you next week.